Well, more Americans die from heart disease than from any other cause. February is American Heart Month, and Dr. Barbara Pisani, cardiologist at Wake Forest Baptist Medical Center, joins us to talk more about the disease. Good to see you, and thank you so much for joining us.
Thanks for having me.
All right, so what can people do to reduce their chances of developing heart disease?
I think the most important thing you can do is be healthy. Maintain an appropriate weight, make sure your blood pressure is under control. If you have diabetes, make sure your blood sugar is under control. Exercise, don't drink to excess, and know your family history. Because if your family members have it, there's a good chance you could have it too.
All right, so what are some of the symptoms of heart disease that people need to be aware of?
So when people have heart failure, their heart doesn't work right, doesn't squeeze or relax right, they may be short of breath, have a dry cough, swollen ankles, or bloating. When they're having a heart attack, a portion of the heart muscle may die, so they're going to have chest pain. They may feel like they have a heavy pressure in their chest. It may go up into their neck, into their arms. They may break out into sweat. They may be short of breath. Excuse me. Or people who have arrhythmias, irregular heartbeats, they may feel like their heart is racing. They may feel flip-flops, or sometimes in extreme cases, they might actually black out.
And I imagine that it's really important to be able to diagnose this disease early.
Absolutely, absolutely, because I think the ramifications of heart disease are so significant. Heart disease is the #1 killer in the United States and in many other countries, both industrialized and non-industrialized. So if we can detect it early, we can prevent really serious complications. And we can also prevent some of the long-term manifestations of that. It's a lot easier to take a pill than it is to get a heart transplant.
And I imagine there are some new developments on the horizon, if you could talk quickly about those.
There are. We're developing shock teams, new drugs, leadless pacemakers, non-surgical ways to fix blockages in the arteries and fix valves. So there's a lot of stuff on the horizon that may help people live longer and feel better.
All right, got to make that the last word. Very useful information. Thank you so much for joining us. We do appreciate it.
Thank you so much for having me.